Assalamu alaikum. I am Dr. Irfan Ahmed. I'm working in Mayo Hospital, Lahore, Pakistan. And today I'm going to give a brief introduction of our first book that was published 2 months ago. And it is for clinical examination as a clinical examination guide for orthopedics residents, consultants. There are many books in the market at that have been published internationally of clinical examination. They are I have studied and seen that they are quite extensive. We have tried to make something that is reproducible in a quick manner, that gives you information very precisely and focused on your clinical examination. We have tried to make this book handy as well. It can be used as a pocket book. The whole book was written and proofread by under supervision of my supervisor, my professor Rana Dilawez Nadeem, who is also the author of the book. So in this book, it is very important and very useful for the residents who are just joining in orthopedic department and for the resident who are going to appear in the exam, because the book is exam oriented and has been made very simple, but with simplicity it gives you everything that a particular examination demands. This book was published 2 months ago, and Alhamdulillah, now the book is all over Pakistan and it's being in demand by all the orthopedic residents. It can be helpful to young orthopedic consultants to revise their methods and to improve their skills of finding differential diagnosis. So, right now, it's uh, available in Pakistan. At some cities, it's not available, but we are trying to make it available everywhere. And if you want this book, at the end, I will tell you from where you can have it or you can contact me. I'm going to give a brief introduction of the book. So, we have made this book, all the parts, all the regions have been divided into two broad categories. If shoulder examination, then shoulder examination first, we have discussed it in general. And then we have done shoulder exam case specific. Three cases of shoulder, for example, shoulder pain, shoulder instability, brachial plexus examination. Likewise, I will give you brief introduction by one or two systems. Like this, there is a wrist examination. We have done the wrist examination general, wrist examination case specific, nerves, wrist drop, claw hand, median nerve. The thing which we have added in this book is the quick review schemes that are only one page and gives you the clue what you have to do and what you have to skip to save your time. It gives you best quick review at the bedside of the patient in the ward and while you're going to appear in the exam. So first of all, I'll show you the first chapter, shoulder general scheme. In general scheme, we have first started with a quick review scheme: inspection, palpation, movement, and then special tests that are needed to be performed. This is in general scheme of shoulder. Although the chapter 2 deals with case specific shoulder examination, we have tried to keep it simple, precise, and to the point. We have added the pictures that are of our own department, and you can see the pictures are made by the authors on real patient clinical examination. We have tried to tell residents at even the basic level where to place goniometers in inspecting in checking different movements. And as you see that we have tried to put every picture of every special test, and if they are performed in different ways, we have tried to put the pictures as well. Now, once you have read the general scheme of shoulder, now we have made a second chapter of every region. This is, for example, if you are going to review, if I show you the case specific, there is shoulder case specific review scheme of rotator cuff tear or subacromial impingement. Then the chapter 2 of every region case specific is not extensive. We have just added the boxes of inspection, palpation, and possible findings that in specific case you can have. And then the palpation box, and then the movement, and something that is important in movement, we have added it. Then the special tests. So only in 3 pages you are able to know that what things are necessary in a specific case of shoulder. Likewise, I'm going to show the example of brachial plexus. Brachial plexus has been a difficult topic for residents because there was very less material that was available that is to the point for brachial plexus examination. We have started brachial plexus examination with a little touch of anatomy, that what you must know, and then we started the examination. This examination is also in 3 pages, and after 3 pages you will be able to do the whole examination and make the differential. For example, inspection, palpation, movement, and then the special test. We have added special test, and we have told that what special test is positive, and then where the differential is, where the injury is, in posterior cord, in upper trunk, or wherever. Likewise, we have added the pictures in the end of the examination, but a resident who is new in the ward, a resident who is going to appear in the exam, he can have the quick review of his examination. Likewise, we have done and touched every region. We have tried to make the book small, precise, to the point. We are working on the second edition of the book as well, that may be available next year, because we are getting positive feedbacks as well, and we are trying to expand the book. We are trying to expand the section 2 of every region that has been appreciated by our colleagues. The section 2 of every region, that is case specific, and we may increase the number of specific cases in our subsequent editions. Like if we have added elbow examination, cubitus varus valgus, radial head dislocation, we may expand it, although we have given everything in general scheme. But as the case specific section is being liked by people, we will increase it. The book is available in Lahore at majority of the hospitals and in other cities as well. After the current situation of coronavirus and lockdown, we will try to expand it in whole of the country where the availability issue is being faced. So if you want this book, you can comment in and you can contact me. We will try to send you book as early as possible. And I hope this video will serve the purpose. Any positive feedback is welcomed. Thank you so much.